loading the stream. You're live. Go ahead.
Hello and good afternoon. I'd like to thank everyone who is on the call this afternoon. So today on the agenda, we'll talk a little bit about two of the agency priorities, mental health and aging. As part of that, mention just briefly the waiver transition work. I think quickly just touch on the HIP program and issues around that. So on the Rose v. Hazar lawsuit. And then really want to finish up today highlighting some really important work that the Division of 211 does for all folks around the state. So let's start. We'll start off really talking about our mental health priority. This is an area we as an agency have been focused on now for a little over 3 years, but it's also been a priority really for the governor's office, legislature, and for many of you who are on this call. This has really been a collective approach and really collaborative approach to improving mental health and behavioral health services around the state of Indiana. And one key part of that is around building a really comprehensive crisis response system. And for us, the key part of that is that we really want to make sure that we have a system that both can respond to an individual who has a mental health crisis, but also a system that can prevent them from occurring. And we're really well on our way to having that statewide vision enacted. So it's just over 2 years now that we launched the 988 call centers. And if you look on the graph there, you'll see that since we launched in really the end of June of 2023, we have seen a pretty progressive increase in the number of calls, upwards of about 200% increase. And I think, some of that increase is likely secondary to increased awareness, and that is work that we've been doing and will be doing in the future as well, which is how do we make sure everyone's aware of the 3-digit number to call if there's a crisis. And I think some of it probably has to do just with individuals who are in crisis or who are under stress and duress increasing around the country over the last several years, and certainly coming out of the pandemic. So despite the increase in the number of calls that we have seen that have steadily grown, we really have been able to maintain really great and really robust response. So if you look here, you can see that despite the increase in calls for the 4 call centers and the 5th center we have that does text messages, we've been able to have in-state answer rates in the 95% or better in the vast majority of the months since we launched. And that is a huge change from where we were in the pre-988 days, where we might have in-state answer rates only at 60% or so. I will mention briefly that the 5% of folks that are in that not in-state answer rate, that could be individuals who hung up before the call was picked up. But I do want to mention that individuals who call, if they're a rare case where there is not an available person on one of our call centers, they don't get disconnected. They actually are connected to a national backup center. But really, fortunately for us, that is pretty rare. We are in the top 10% of all states for our in-state answer rate. And I think that's something we've really worked hard to maintain and something we're really, really proud of. I think it's really important to remember that the 988 call center is really just one part of a comprehensive crisis response system. We knew from the beginning that occasionally you're going to have individuals who call 988 and are going to need more help than can be provided over a phone. And so in those cases, we needed to build a system that had teams that could respond in person to help individuals. And if that response was not enough, then we also recognized that we would need facilities around the state where individuals in crisis could go to get stabilized. And so the mobile crisis teams and the crisis stabilization units really are sometimes considered the second and third pillars of the system. We have also made a lot of progress on this work as well. So if you look a year ago, we had a couple crisis centers and a few mobile crisis teams out there. And fast forward in just 1 year, and we are currently providing coverage for upwards of 2/3 of our counties. And so while we still have some gaps and we're not statewide yet, we are well on our way to getting there. And so we are going to continue to work to grow this capacity and to reach that statewide goal really over the next several years. Now, another key part of the crisis system is the state's move towards certified behavioral health clinic model, or CCBHC, which is certainly easier to say. So I thought I'd take just a couple minutes talking about what a CCBHC is, how that really significantly changes how Hoosiers will get mental and behavioral health services and how they'll get the care they need. So I think in the simplest term, a CCBHC is a different way of paying for mental health services. So instead of paying for each transaction, it is a prospective payment, which means you're really paying more for the management of a population and not just an individual. And it's the same type of system that we already have in our federally qualified health centers, or FQHCs. But when you change that payment system, right, one that now better aligns with the actual cost of delivering care, the CCBHC in return has to provide an enhanced level of services. And that includes 10 evidence-based practices, includes more availability, more timeliness. It includes strict quality standards and more transparent data. And a key part of the crisis system as well is it also means that they have to have 24/7 access to crisis services. And so it is a different payment system in this prospective payment system, but with that, you get a more robust, accessible mental health system. And so when we kind of look at this, this would be a really big shift for us in the state. Now, a CCBHC has to provide 9 core services. And if you look at that list on the right, you'll see that it is everything from, as I mentioned, crisis services, but it also includes screening, family supports, veteran supports, connections to community and social needs in the community. So it really creates a much more comprehensive, holistic list of services for individuals who come for services. And it's not just for adults. They also have to include developmentally appropriate care for children, for youth, and for aging Hoosiers. So it collectively for us would be a really massive change in the right direction for the state. It creates a system that's more transparent, better linked to the community, and more holistic for the individuals involved. Now, a key step for us to make this move was to apply for a CCBHC demonstration grant. This is a SAMHSA grant. And the benefits of this is it offsets a lot of the state's costs to get this up and running. So to get this started in a select number of facilities. And so we approached this. We asked mental health providers from across the state to apply to participating in this demonstration. So we went through those applications and we picked the 8 best of those. Now, I will mention it wasn't just community mental health centers that could apply, but it does turn out that the top 8 of those are community mental health centers. And so you can see on this map here, those are the demonstration pilot sites and service areas around the state. And so we have both different size community mental health centers, but we also have, I think, a really good geographic representation. And so we'll learn a lot from this. And the reason we'll learn a lot from this is that we found out in June that we were one of 10 states that were awarded this demonstration grant. So that was a huge accomplishment for our team. And I have to give just huge credit and congratulations to the Division of Mental Health and Addiction and the Medicaid teams and their leadership for really coming together on this application in a truly collaborative way. This is not successful without all of our divisions really working hand in hand on this. And we got outstanding in every section of this application award. So really, really proud of the work they did. And so now, once you're given a grant, then really the work begins on implementation. And so they are now working really hard and frenetically to plan for a January launch in these particular facilities. So much more work that we'll be doing over the next months, but really excited that this is the direction that we're heading. And so with the move to CCBHC, it really does create a complete crisis system, because now we have, for individuals in an acute crisis, we have a place they can call to get help if they need it. We've got teams that can respond, and locations they can go to get stabilization and get acute crisis care. But then we have a more robust mental health system in a community that really can work on both ends of the crisis continuum. One is that that's the place where they can go after they've had their crisis stabilized, so that that first crisis is the last crisis. And also on the front end, by having more accessible, more evidence-based services, it's also the place individuals will be able to go to get service to prevent a crisis from occurring in the first place. So really excited. There'll be a lot more information, a lot more stakeholder work around this. So stay tuned. Now, another area that we have really prioritized and focused over the last 3 years and more is really around changing and creating a Medicaid system for older adults that allows them to have the option of where they want to age, and particularly give them the options if they want to stay in the home and in the community setting. And so this collectively is our Indiana Pathways for Aging program. And while there has been a lot of different parts of this system that we have been working on and will continue to work on over the next several years, the largest part of this, at least initial one, and certainly the one that has generated the most public attention, is the movement of roughly 123,000 Hoosiers who are over the age of 60 who have been in a Medicaid fee-for-service system, moving them into a managed long-term service and support program. And so that we launched just over 2 weeks ago on July 1st. Now, the benefit of this really is that this allows individuals the ability to have a single point of contact to navigate the complexities of our healthcare system. Because for individuals over the age of 60, and many of them, they're going to potentially have state plan services, they may have waiver services, they may have Medicare or Medicare Advantage services. And so that's this real complex network of who's my provider, what's the eligibility, how do I navigate it? Now in the Pathways program, they have the ability to work with one health plan, and it would be either Anthem, United, or Humana, who is really, as the program has been designed, charged with helping them to navigate all of the complexities of the medical as well as the home and community-based services. So that includes, helping with provider networks, transportation, pharmacy, hospitalization, home services, you name it. And so in many ways, this program has taken individuals who had to navigate a complexity of various services, and it's put them in the center and really wrapped around them through the health plan and through the state oversight, all of the services that they need. So we really have been working hard on this over the last several years, but the last 18 months in particular, we have been working really hard to make sure that the health plans were ready to go. And that work has included reviewing, and I mean thousands of pages of documents, doing on-site testing, doing claims testing with providers, helping to navigate the complexities around service coordination requirements, and then fixing problems as they come up. I think anytime you've got this large of a program implementation, you're going to see issues pop up. The goal for us really has been to having the ability to rapidly identify those and to rapidly correct those. And that has been the work we have really been doing over the last year and a half. And it has meant that our teams have really been working at a frenetic pace, as well as the managed care entity teams, and collaborating and collectively working with the provider groups. But that work and all of that activity has really started to pay off. Since our launch, we've been able to see pretty seamless service delivery to making sure that, when that switch, the metaphorical switch was flipped on July 1st, that people were still showing up to individuals' houses to provide care, and individuals are still able to get care from their doctors. And also really working to make sure that that system is in place to make sure that providers understand the claim systems and the payment systems. And so along with that, our teams have been working really nonstop on answering the hundreds and hundreds of questions that have come through to our teams, and we will continue to do so. And I'll say that the Pathways program, it has really been a monumental lift for the agency, and really doing it in a collaborative and thoughtful way. But when you combine and add on to that amount of work, the public health emergency unwind work, the budget and forecast challenges that we've had, various lawsuits, and just the countless number of obstacles that have popped up in our path, it is an incredible testament to the work ethic and the passion and really mission of our teams to build a system that really assures that aging Hoosiers get to choose where they age. And we now have a system, and I think that really in the future is going to more readily allow individuals to do just that. And so just a lot of ongoing work to do. If people have questions or if issues come up, we want to certainly hear about it. Certainly if they're managed care specific, they should reach out to the managed care entity first. But if not, and if they're not getting resolution, then there's a number that they can call. Certainly members can call as well, 87 Pathways 4. And there's a website as well that you can go to send information. And that's it's on the web, in.gov/pathways. Now, with the launch of Indiana Pathways, that has necessitated some changes to what previously had been called the Aged and Disabled Waiver. So this was a waiver run out of the Division of Aging that provided home and community-based services to individuals who had complex medical conditions. And really the goal of the waiver and a lot of our waivers is to provide services so that individuals can stay in their communities. And so with the move to Pathways, individuals who had been on the Aged and Disabled Waiver, who were over the age of 60, are now on the Pathways Waiver. So same types of services, but now it's the Pathways Waiver that is now overseen by the Office of Medicaid Policy and Planning, or a Medicaid team. And the services will be coordinated now through the managed care entities. Now, for those individuals who were under the age of 60, who had been on the Aged and Disabled Waiver, those individuals are now moved to a waiver that's called the Health and Wellness Waiver. Same services, just new name. And that is going to be managed by our Division of Disability and Rehabilitative Services. The service coordination around that will continue to occur as it did before, either through one of our AAAs or independent case management organizations. So now, one of the unfortunate effects of the forecast budget challenges is that the rate of growth of individuals who had been coming onto the previous age and disabled waiver over the last couple of years, combined with the massive increase in expenditures, meant that we exceeded both the number of waiver slots that we had on the age and disabled waiver, as well as the budget to expand slots. And so that has the unfortunate necessity of having a wait list. And so what that meant is that as of May, no one could come onto the waiver until new slots were available. Now, waiver slots cycle on a state fiscal year calendar, which means that July 1st, we were able to create new slots again that will allow us to invite members both onto the pathways and onto the health and wellness waiver. It's important, I think, just to mention briefly that being on the wait list doesn't mean that you have gone through all of the eligibility steps and you're just now waiting to get services. Really, it means that you might qualify. And so once that slot is available, then you need to go through the eligibility process. And that process takes time. It may require functional eligibility. It also can include fiscal eligibility for things like Medicaid. And so for some individuals, that can take a couple of weeks. Some others, it might take a couple of months, particularly as information or documents are needed. And so to manage the wait list and the capacity of the system to process new applications, we will be inviting 800 people off the wait list each month for the pathways and 125 individuals each month for the health and wellness waiver. We will then work with our AAAs, our managed care entities, our independent case management organizations to help guide the individuals through the eligibility process. Now, if you go back to prior to having a wait list, we would typically see somewhere in the 800 to 1,000 or so new individuals coming onto the waiver each month. So 925 is in the ballpark of what we would have been processing every month already. We will certainly look at the process as we go along and as we kind of adjust to the new normal here. And if possible, we will increase the number of individuals that we are able to invite on those monthly invitations. I think it's important just to briefly mention what we can share right now around the HIP lawsuit. So this is sometimes known as the Rose v. Azar lawsuit. This has created some uncertainty in our HIP plan. So as has been reported in the news, last month, a DC judge vacated, which in non-legal terms means got rid of, the CMS's approval of the HIP program waiver. And so that has created some uncertainties around the program that we are working closely with CMS and others to address. I think for folks on the call listening, short-term individuals on HIP are still covered and providers who are caring for them are still being reimbursed for that. But long-term, it has created some uncertainty on what the HIP program will be, what services will be covered, how it will be operated, and what the fiscal sustainability of that is going to look like. So we are, as part of that and trying to kind of get to those answers, we are pursuing, first of all of our legal avenues to address this and have asked for and be working with CMS for a reapproval of the waiver. So we're going to continue to do everything we can to assure the long-term viability of what has been for us a really critical and really important program, not just for the state, but obviously for all of the individuals who have their health care through this program. So we will continue to share information as we can and as it is available. So keep an eye out for further updates as we learn more. I want to finish now really just highlighting and making sure folks really understand the critical role and really important role that Indiana 211 provides. So keep in mind, 211 moved into FSSA as our 8th division in January of 2020. Prior to that, it was operated in part through United Ways, through some state support. And so by moving it into FSSA, we have really been able to leverage their skills and to use this as a way to respond to a variety of needs around the community. And I think the question sometimes people ask is, what does 211 do? But as I will talk about, it might be easier to say what 211 doesn't do, because as you'll hear, they do a lot. At the heart of 211, really their fundamental kind of service is what we call a community navigator. So these are individuals who are state employees who are highly trained, skilled listeners, and what I would say connectors. So if an individual calls 211 with a need, they are able to empathetically listen, understand the issues, and then, because of the resources they have, connect them to a variety of community or state resources to help them with their individual needs. So for instance, if they're food insecure, if they're having challenges with getting enough food on the table for them or their family, 211 would be a place that could help connect them to local food pantries, but also can help connect them to resources around becoming eligible for SNAP benefits. If someone was a victim of domestic violence and needed to find a safe place to go, or individuals just needed general housing supports or clothing or education or job search, tax assistance, legal aids, and a lot more, they can just call 211, and 211 can help connect them to state and community resources. It's really as simple as Tara likes to say, our 211 director, as calling 211. And connect they do. In 2023, for instance, they're averaging about 16,000 calls a month for folks calling in really for community needs. But those aren't the only calls they take. They take about a similar number, 16 to 17,000 calls a month as well, for a variety of other needs and other services that they offer. Now, some of those services that 211 helps with are situational and have time limits to them. For instance, I think the easiest way is that they came in 2020, the pandemic hit, and we were able to very quickly utilize 211 and the ability for folks to simply remember the number and to contact them, to make that the single number that Hoosiers could call if they needed to schedule a COVID test or to get a vaccine, or if they had questions around the pandemic. And in that role, during the public health emergency, they took over 1.3 million calls. They scheduled 300,000 vaccines, took about 400,000 information calls, and scheduled tens of thousands of tests. So, like, 211, because of their ability to rapidly shift and scale up, has been really important for us as a state to respond to emergencies. And so they partner really closely with the Department of Homeland Security. So when there is an environmental emergency or disaster, so you get a tornado like those that happened this week, individuals can call 211. They can both let them know that they've had damage to their property, and that then gets categorized and sent to Department of Homeland Security. But on that call, 211 can then also help connect them to housing or food or clothing or other support. So it becomes a single number to call around disaster response. It also is an important number when environmental conditions really get dangerous. So when we have a big heat wave, and we know there may be folks who don't have air conditioning or don't have cool environments, like, they have all of the cooling centers around the state, so folks can just call 211 to find the closest one to them. Same when it becomes really brutally or brutally cold, individuals can call to be connected to where warming centers are. In addition, prior to the launch of 988, 211 also helped connect people to mental health and substance use disorder resources. So folks could call 211. The Be Well helpline, which we launched during the pandemic, was part of 211, and then folks could call and get connected to resources. Now, since we have moved to 988, at the end of June, we shifted the Be Well line to 988. So now individuals really would just call 988. But if somebody does call 211, it's not a worry, because we are on the same system, 988 and 211. It really makes a true warm handoff almost seamless. And in addition, 211 does work with our Office of Early Childhood and Out of School Learning around helping folks get connected to CCDF vouchers. They do work with IHCDA on both utility assistance and emergency rental assistance. So again, they kind of do everything. And if it wasn't enough, they have just launched 211 University, which is really a novel and innovative way for them to kind of connect with the thousands of communities that they work with. So their database in many ways is our state source of truth of what's out there in the community. And as part of that, they therefore work with thousands of community organizations. Now they're going to collaborate those organizations monthly to help improve the quality of life of Hoosiers. And so this will have, just like University, monthly topics. Like I think the one that happened this morning was how best to utilize 211 in your organization. But there'll be monthly topics that will be presented by professionals across our communities that will help us to really highlight and focus in on things that are important in individual communities, whether that's domestic violence and resources or suicide prevention or more. So as I mentioned, the first one of these launched this morning. You'll see a QR code there on the screen. If individuals are interested in participating in future events, just scan that QR code and that'll take you to a place that you can log on and you'll be added to that mailing list. So again, as always on these calls, we've got a lot that we are doing and a lot that we're working on to meet the mission of our organization. Really to make sure that we continue to compassionately serve Hoosiers across the state and that we do so in a way through improvements so that individuals get a chance to live in fully engaged communities and reach their greatest emotional, mental, and physical well-being. So as always, thank you all for tuning in. I appreciate it. I hope everyone has a great summer and look forward to future